Welcome everyone. Today we have our Dr. Hiba Ismail, an Ayurvedic doctor. She is an expert in integrated medicine. Also, she is focusing on Parkinson disease. Welcome, doctor. In most of the studies, it is revealed that out of 1 lakh people, 350 of them were affected with PD, this Parkinson disease. So, can you please share your perspective about Parkinson disease?
Parkinson's disease is a chronic degenerative disease affecting the nervous system. It starts with symptoms such as slowness in everything and tremors, etc. So the clinical features starts like motor symptoms and non-motor symptoms. Motor symptoms are mainly of 4 things, that is tremor will be there, bradykinesia will be there, rigidity or stiffness will be there, and also postural instability. So they will be in a leaning position. And the other non-motor symptoms which we used to see is depression, autonomic dysfunction such as constipation, urinary incontinence, then mood disorders and many others which are less noticed. And if we go to the stages, according to Horn-Yan scale, it is 4 stages are there. First start with unilateral affection, that is one side of the body will be affected. Next will be bilateral, that is both sides will be there. That is a second stage. And the third stage comes like with some support they will be able to walk. And the fourth stage will be not in the walking, but in overall aspect there should be a support should be there. And comes the fifth stage, that is completely bedridden stage. So our treatment also focuses on which stage they are, starting with the initial stage.
Doctor, also we would like to know more about PD, that is the causes and the risk factors of PD. Can you please share your perspective?
Yes, the causes of PD are not well known, but the main causes are genetic and environmental factors. And the risk factors are, first one is age. The age factor comes from above 50 as the main causative age for PD. And there are young onset Parkinson's also, that is below 50 years of age. Next comes the genetic factor. So if a parent or sibling is having a Parkinson's disease, there is a chance. That is also not, researches are going on only. And next one is environmental factors. Many pesticides has seen influence in Parkinson's disease. And then comes the head trauma. Head trauma also is a risk factor.
Head trauma means?
Head trauma means during some accidents or injuries to the head may also, these are all researches not well established, but these seems to have a causative factor in Parkinson's disease. So the main pathology or the physiology happening is, pathophysiology happening is the Lewy bodies in the brain is there, that is in substantia nigra, alpha-synuclein, that is a protein deposit in the Lewy bodies. These causes the loss of dopaminergic neurons in the substantia nigra. So then causes a dopamine decrease and then leads to the motor symptoms like tremor, movement symptoms and the non-motor symptoms.
Okay, that is the dopamine insufficiency is the main cause for PD, right?
Yes, dopamine insufficiency is the main cause of PD.
Also, doctor, can you please tell me the Ayurvedic view of Parkinson disease?
Parkinson's disease, according to Ayurveda, is considered as Kambavada. Kambavada, Kampa means tremor and it is a disease of Vada, imbalance. And all the other doshas like Pitta and Kapha also come in the progressive stages of the Parkinson's disease. So the treatment also mainly focus on the correcting the Vada imbalance.
Okay, doctor, you tell me about that tremors. Can you please explain what is trauma and how it happens in patient's body?
In Parkinson's disease, the tremor is mainly of resting tremor. So when we are resting, the tremor happens. And also there are, according to the stages of disease, there comes the dyskinesia also. Dyskinesia are the involuntary movements of the body which happens because of the Parkinson's medicine and also because of the Parkinson's symptoms also. It will be a shaking of the body. First starts with unilateral, that is one side will be tremor and next comes the full body tremors. Some patients it stands from hand and then goes to the leg and all. So there is different types of Parkinson's also. The tremor predominant Parkinson's and rigidity predominant Parkinson's, and also in some cases both tremor and rigidity will also be present.
So, doctor, can you discuss about the treatments available for Parkinson disease, both in Ayurveda and modern perspectives?
Levodopa is considered as a golden standard for the Parkinson's disease treatment. So we want a customized integrated approach from both allopathy, Ayurvedic, and also the other complementary therapies such as yoga, Tai Chi, all these combined together, and also acupuncture, physiotherapy, all this combined to form an integrated approach treatment should be needed in the Parkinson's disease. So in modern, it is, as I told, it is levodopa and other medicines such as dopamine agonists are there, and other inhibitors such as pramipexole, amantadine. Lot of medicines are there. Along with that, Ayurveda should also be integrated. Coming to Ayurvedic aspect of treatment, there are two types of treatments going on. That is Shodhana, that is a purificatory procedures, and the Shamana, that is the pacifying treatments. In the Shodhana, there comes the Panchakarma, which includes Snehana, that is a oil application, and also internally also taking oil or ghee preparations according to the Ayurvedic doctor's advice. Then we go to the Virejana or Vamana procedure, in which we decide by looking which dosha is more predominant. If it is Kapha predominant, we will be doing Vamana therapy, and if it is Pitta predominant Parkinson's, we will be going to the Virejana therapy. Then we will go to the next treatment, that is Vasti. Vasti is considered as the half of the treatment in pacifying Vada. So it is also a golden standard in pacifying Vada. So Vasti treatments will be going on. Then Shirodhara and Nasya. Both of this also has great influence in treating the Parkinson's disease, especially insomnia, speaking difficulties, etc. Then goes to the Shamana treatment, which include Kashayas and other Gulikas to be intake, which also discuss about the reduction of Vada. Then goes to the single herbs are there like Mucuna prudens, which is very good, very much effective in treating the Parkinson's disease.
Okay, doctor, can you please explain the significance of Mucuna prudens in Parkinson disease?
Mucuna prudens, also known as Kabikachu in Ayurveda, is very much effective in treating the Parkinson's disease. So in that, levodopa content is naturally present. Researchers has found that levodopa is naturally present in this drug called Mucuna prudens. So this help, along with levodopa as a synthetic drug, this also help in reducing the Parkinson's disease symptoms. It is also an antioxidant, and a neuroregenerative effect is also seen in Mucuna prudens.
You have already explained about the effectiveness of Mucuna prudens. Like that, there may be any other herbs that helps in decreasing the symptoms of PD patients. Can you explain some of them?
Along with Mucuna prudens, there are many herbs such as Ashwagandha, which is also called Withania somnifera. This helps in neurodegeneration and also controlling the stress levels. This will also help in symptoms reduction in Parkinson's disease. Next comes the Brahmi. Brahmi is called as a brain drug. So it will help in the same as this, that is neuro regeneration, and also it help mostly in the constipation, which is one of the most important symptom of Parkinson's disease. Then comes Jadamanji, which is also a mind cooling drug. These herbs help along with Mucuna prudens, and many other kashayas and other classical drugs are also there in controlling the Parkinson's symptoms, such as Dhanada Nayanadi Kashaya, Maharasnadi Kashaya, and other gulikas such as Spriti Sagar Rasa, and many others are there according to that can be selected according to Ayurvedic doctors' support.
Okay, ma'am, you mentioned about Ashwagandha, and which part of this plant is taken for the medicine purposes?
Ashwagandha is used as a whole plant as a medicinal purpose. So in this case, especially in Parkinson's disease, in the nervous tissue disorders, Ashwagandha's root is used as the medicine.
Doctor, you have mentioned about Panchakarma, right? And what are the benefits and follow-ups of this treatment?
So as I have mentioned, Panchakarma treatment include the Snehana procedures, Svedana procedures, and Shirodhara, Vasti, etc. will be included in the Panchakarma treatment. The benefits are, as I have told, Vada reduction. So by this reduction of Vada, the symptoms of Parkinson's will get down to minimum. So the full cure is not possible, but to a minimum of symptoms with a good quality of life and reduction in progression. These will be the aim of the treatment. So regarding the follow-up, correct follow-up should be done. That is, if you are doing the treatment, that is Panchakarma treatment, it should be repeated in first year, second year and third year. By 3 years, we will get a good benefit. And regarding the medicines also, there should be, the doctor will prescribe like 1 month medicine, this kashayas and all, and it should be done in a correct follow-up method.
Okay, anyway, we have a good discussion with Dr. Hiba Ismail, and she has given a good knowledge about the lifestyle practices of a PD patient and also the what is Parkinson disease and what are its symptoms. So, thank you, doctor, for giving us a good section.
Thank you.